So, Dr. Valentine, what's your assessment?
We should run FBCs, use E's, clotting, and an ECG.
Oh, that's going to cost.
Rakesh was in the budgeting office.
More exciting than it sounds, I hasten to add.
Well, it certainly has its perks.
That one conference in Sao Paulo in particular? A couple of mojitos and Elliot surprisingly limber on the dance floor.
Well, you know, when in Rome.
You ever been?
No.
Oh, you should. Beautiful city. Beautiful people.
Yeah.
What do you think it is? Mammary vice tear?
Most likely.
How did he get himself to such a state?
It's Christmas, Judith. It probably got out of hand. They don't really think. God, when I was his age.
This is more than some binge, Mark. Oh, I was so angry with him when he came in.
Of course you were. You're his mum, that's your job.
Matron, I'm sorry to disturb you.
It's all right, darling. What is it?
Your husband called again.
Do you know what he wants?
Connor was going into theatre. I didn't know what to do. I answered your son's phone.
Well, what did he say?
He's on his way.
Hallelujah. About time. Really could have done without this today. Okay, Mrs. Mgevity. Man? Will you sit up for me, please? You say you got these when you had the flu?
I was laid up for more than a week. My daughter had to take time off work to come and look after me.
Must have been some bout. I have to admit, I've never seen a patient with sores like this from bed rest.
Just unlucky, I suppose.
Okay, well, we will get them debrided for you and drain those abscesses. Nothing too serious. Should have you out of here in a couple of hours after the op.
She's lying about how she got them, right?
Definitely. Looks like she swapped her mattress for a park bench, but that is a post-op care concern. We have an elective admission in at 3, so I'm in the bed by then. Meantime, push fluids and 1.2 grams of comoxiclav.
No problem. Why would she lie?
Who knows?
Look, I'll swap you Mrs. Rowe's bed too for her, okay? She's on hourly obs, I've just done them.
Well, why? I mean, she obviously doesn't want us interfering.
Oh, come on, look, you said you'd help me out today. There's a lot riding on this for me.
Okay, as long as you let me go and do my stint for the kids on paediatrics.
All right, yeah, thank you. Okay, just hourly obs, yeah? Don't forget.
I'm so sorry, Matron. I really am.
It's okay, Holly. Get that.
How can she be so stupid? She knew I didn't want him here.
She made a mistake. She didn't mean any harm.
Connor needs me right now. Paul is only ever interested in point scoring.
So don't let him drag you into it.
You have no idea what he's like. This divorce, it's become like an obsession for him. He's a nightmare to be around, let alone in a crisis.
I won't let him bully you, okay? You just focus on Connor. I'll deal with Paul.
Hey.
Hey.
How you feeling?
Dunno. I'm dancing on the ceiling.
I'm sorry that you can't fly back to see folks over Christmas.
I just wanted to go back for my mum. She lost her dad this year.
Again, I'm so sorry.
And the sun, obviously. Nothing like a winter tan.
Well, I always prefer the pale and interesting look myself.
Maybe it's not such a bad thing.
How are they looking, Dr. Valentine?
Temperature's normal, BP's at 100/64, and pulse is at 80.
Okay. Right, we have some news for you, Mr. James. Your heart is beating erratically, but it is something we can treat easily with drugs.
Great.
So we'll keep you in overnight, and you should be free to go tomorrow. I thought you'd be pleased. Out for Christmas?
Gives me time to do my Christmas shopping. She's a laugh a minute, isn't she?
She's not that bad once you get to know her.
I could just do with a laugh right now.
Hey, you still got me, remember? You're my star patient.
Dad, any joy with discharging Mr. Granger?
Oh, I got held up. I'll talk it through with him. Can you just give me a sec?
I'm Paul Marchant. I'm here from his son Connor.
Yeah, I'll just get Mr. Williams' food.
Do you think you should get involved?
I'm a consultant nurse here, Mark Williams.
Where is he?
He's in theatre at the moment. I can take you through. He was brought in with alcohol poisoning.
Oh, God.
Yeah, well, he's got an internal bleed now. They're fixing it.
Judith, why didn't you call me?
Because I was here.
But he's in theatre.
He took a sudden turn for the worse, I'm afraid, and we had to act quickly.
I'm always the last person to know. I had to find out from some child with Connor's phone.
Why don't we wait for him in the side room?
Good idea.
What are they all staring at?
Because I work here, Paul. This is my ward.
So, this way.
How long have I got, Doc? Tell it to me straight.
I'm afraid you're suffering from angina, Rakesh.
Angina. This is where you give them the list of things I'm not allowed to do anymore, right?
There are a few lifestyle implications, but you can grow accustomed to all sorts of things, believe me. Even carrot sticks. Dr. Valentine will explain your treatment shortly.
And help Mr. Hope.
She seems very keen.
Very funny.
Good rapport with the patient?
Yes, she's one of our most talented F1s.
Have you told your parents that you're not coming
Small
yet?
changes.
No, I haven't. Not yet.
What's you waiting for? Look, it's not going to get any easier.
My phone's out of battery. I haven't got a charger.
Then use the payphone.
You don't give up, do you?
No, I don't.
I need to keep you in for a few
You
hours.
really should do
just
this.
To, check that the drugs are working properly.
Yeah, I've got them.
Good. Right. I'll leave you to it then.
Okay. I'm just going to show you how to use the heparin. If you could just,
You'll be gentle with me.
Son?
Mr. Marchant.
Yeah.
How did it go?
Well, we've stemmed the bleed. He should recover well.
Thank you.
Do we know how much she had to drink?
Judging by the levels of alcohol, it must have been pretty strong stuff. He's been in and out of consciousness ever since he was brought in.
Aren't you supposed to call next of kin straight away?
I said I was here, Paul. Please just leave it.
Oh, right. So you just shut me out.
I was thinking about Connor.
Do the girls even know you?
I didn't want to worry them.
Another one of your unilateral decisions.
You know, just how late was this party last night?
Stayed over there. I don't know. He's 17.
She's just trying to help, that's all.
But Connor is suffering from severe abdominal pains. I think that's really what we need to get to the bottom of here. We'll know more when the scans arrive, but...
Was he complaining of stomachache at all this week?
No, I would have got him to a doctor then, wouldn't I? Son, it's all right. I'm here now.
You must have noticed something. Look at him.
As usual, you don't believe a word I say. What's the point in asking, eh? You might as well ask your mates here.
As soon as she comes up, she's straight into the side bay. Yeah, and you're dealing with bed 7. Hey, how are you feeling?
Not too bad. Bit groggy.
Well, you'll need some pain relief and some TLC for a while. Is there anyone who can pick up a repeat prescription for you?
I'll ask my daughter to do it.
Will she be able to give you a lift home?
I'll make my own way.
If you could just lean forward. You know, it really would be best if someone could give you a lift home, rather than you waiting in the cold.
Just call me a taxi, please.
Maria?
What is it?
Mrs. Shaw's just arrived. The elective admission. What should I tell her?
Look, can you stall her for a while? I need a bit more time with Mrs. McEvedy.
Okay. But we need the bed, and we are a nurse down.
Well, isn't Donna back yet?
What do you think?
Maybe I could move you into the side room for a bit. You know, just so you can get a bit of rest before you go home.
So chest pains haven't eased up?
Only hurts when I breathe.
Right.
On the plus side, the longer I'm here, the better we can get to know one another.
And do you have pains anywhere else beside your chest?
Well, there's this. But it's nothing.
Between your shoulder blades?
Yeah. Ow.
I'm just going to take your BP.
Ooh, warm hands. Should I be worried?
No, just routine.
It's just, if it doesn't look good, I'd like to make most of the time I've got left.
Other arm, please.
You seeing anyone at the moment?
I hardly think that's appropriate.
I'm gonna ask.
Yes, well, let's just stick to the meds, shall we? Right. I'll see you in a moment.
Psst. He's a sugar daddy, isn't he?
Yeah, he's a bit of a lurch. Have you called your parents yet?
I haven't got any cash.
No more excuses.
Dr. Valentine. Maybe I didn't make it clear about this banter with Mr. James.
I was just giving him some advice.
Medical advice, I assume.
Actually, I was just coming to talk to you about Mr. Modi. I think I may have spotted something. I've checked his BP in both arms. It's 100/65 on his left and 80/55 on his right.
You think it might be a dissection? And the drugs haven't taken effect?
Nope. And he's complaining of pain between his shoulder blades. Now I'm concerned it may be a tear or damage to the inner wall of the aorta.
Good work, Dr. Valentine. Very perceptive.
Connor's scan results.
Head CT is clear, no brain contusion.
Good. So he didn't have a fall then?
No. His appendix looks inflamed. We'll need to take it out.
Is matron okay?
Why'd you ask?
I told her husband Connor was here. I didn't mean to.
So the problem is...
They're separated.
Well, why was Holly asked to contact him?
It was a mistake.
It was my fault. He called, and I wasn't thinking. I'm sorry.
Right. Have you apologized to her?
I tried.
Then I suppose you've done all you can.
I'll make sure he's prepped for theatre.
So, is it a perforation or...?
It's his appendix.
Right.
So, what does this mean?
It means he's in agony. That's what it means.
The amount of alcohol in his system might have masked it. We'll get him to theatre as soon as we can, OK?
How much did you let him drink this week?
It's Christmas. You're the nurse, so why didn't you pick up on it earlier?
He was fine when I last saw him.
The important thing is we have a diagnosis. We've got something to act on.
You know,
Have you
I
got a minute?
trusted you with him this week.
I'll be with you in a second.
He was just trying to wind down while he had the chance.
Wind down? He's 17 years old. What does he need to wind down from?
You said it was just angina.
Well, dissections can be tricky. You're lucky that Dr. Valentine spotted it.
Well, I'm honoured, thank you.
It's all part of the service.
So how can you fix it?
We'll get you into theatre, replace the section of aorta where the tears occurred.
Look, I really wasn't expecting all this. What are the survival rates like?
90% of patients come through safe and sound.
Right, so there's a 1 in 10 chance I won't.
Honestly, Mr. Modi, aortic dissections are very common in men of a certain age, and many survive to grow even older.
Hi, Mum. It's Scott.
I won't let anything happen to you, Rakesh. In a couple of months, you'll be drinking mojitos again.
Cheers, Elliot.
Yeah. Just
You definitely get the personal treatment here at LBA.
You should sit in on this one, Dr. Valentine, seeing as though it was you that spotted it. Thanks.
Thanks, Mr. Hope.
So will you be prepping me for the op?
Yeah, well, I hope to come over for
No.
Boxing Day.
I'm sorry to disappoint. A nurse will be along shortly.
Cut off me!
Okay, Mr. Granger, calm down, will ya? Calm down! We can do without another showdown.
I just need to sort out his medication, sign the paperwork, and then I'll get onto it.
Great, thank you.
Behave.
You should be comfortable here. I can send down for some clean clothes and food. I mean, it's not a problem.
That would be nice.
Well, you can stay here until another post-op patient needs it.
Oh, Nurse Kendall, why is Mrs. M still here?
Well, she needs a hostel placement.
Yeah, I get that, but this isn't a hostel.
She needs our help.
Yeah, and I need you on the ward. Get Nurse Jack.